Hi everyone. Sorry I can't be there this week. I'm unfortunately out. But I trust that Ryan and Kelly were able to answer some of your questions, and I also have your list of questions here. Again, if you have any other questions, you should email Kelly. Uh, Certain programs have very specific directions. Some of you also may not be fully enrolled because we don't have all of your documents in or your second payment. So um, if this doesn't apply or it seems like you're missing something, it's always best to just ask Kelly. Email her, email support, and we'll get you the personalized information. So we had a lot of questions for this orientation. Thank you for that. But I'm going to break them down into six general questions, and then if you have any further questions, again, you can just ask Kelly. If there's something specific, you can ask me as well. But we should be able to help you. So in general, I'm going to start with what to bring on your first day. So on your first day, I generally say bring a white coat. You may not know if your physician actually wants you to wear your white coat, but it's always better to be over prepared than under prepared. You may get there, bring your white coat, and your physician says, "Oh, we just dress business casual here." That's fine. At least you look good. You look like you came ready to work. Beyond that, I usually say stethoscope, pen and paper. Um, you may also want to bring, your phone and your headphones for what if you have any off time. I would just say the key for that is don't use your phone during the rotation when you're supposed to be working. Some physicians will say, "Hey, bring your phone so you can use an app for medical dictionary or looking things up." It's really important. So make sure you have your phone, your white coat, stethoscope, pen and paper, and I would say the more, you don't have to bring too much, but it's better to bring more things than to be underprepared, because if you're underprepared, it's a bad first impression. So if you have any other questions about things you need, there were also some questions about things that you may want to read to prepare. If your description doesn't say that there's a specific text that you're supposed to read, you should be fine. I would just tell you to maybe brush up on some of your fundamentals in the specialty of the program that you're going for. Or if you haven't done that before, let's say you're doing gastro rotation and maybe you've only done IM. Review your IM texts, maybe look into a little bit of gastro, but the physicians have seen your CV. They know your qualifications. You're not going to be embarrassed or anything by not knowing something. In fact, I always encourage students ask a lot of questions. It's better to ask questions, and it's better to say I don't know and put yourself out there as somebody who wants to learn than to just be quiet or pretend like you know something. That's not the purpose of the rotation. When you're there, you're going to have to make yourself vulnerable. You're going to have to be willing to say you don't know, and your physician, they're there to teach, so they're more than happy, to answer those questions. They want you to ask questions. Makes their job easier. So the second broad question, we got a lot of questions about what to wear. This may have been covered already, but business casual is the setting of dress, and that usually means slacks for men, closed-toed shoes for both women and men, dress shoes. No high heels are necessary, flats. You may, want to wear, if you're a man, a tie. And again, if you need any help on what business casual is, you should be able to Google it, or you can ask Kelly, ask myself. We'd be happy to help you out. Again, white coat, I would just have it with you. If you're going on a surgical rotation, definitely you can bring a pair of scrubs. Just bring it in a backpack. You'll have a place to store your backpack for the day. If you don't have scrubs, that's okay. Usually the hospitals or the surgery centers will have a place to buy scrubs. Or the physician, nurses, they should have an extra set for you. But again, it's always better to be over-prepared than under-prepared. So we had a lot of questions about just general expectations from, what do the physicians expect from you, and then how to ask for a letter of recommendation, how to make clear that you need a letter of recommendation, and then what to do to earn it. So on the first day, I always say to go to your preceptor and say, "Look, I'm here, to learn. I'm here to get experience in the U.S. medical system, but I'm also here to earn a letter of recommendation for the ERAS or a different country's match system. It's fine to set that out very early. But don't be afraid to say, hey, what can I do to show you that I'm, worthy of being a physician in the U.S., or I'm professional, or I'm going to be a good doctor. And your physicians will be very frank. I mean, they work with residents, they've been residents, they work with medical students, they've been a medical student. So again, communication is always key here. If you're not comfortable to talk about the letter of recommendation right away, just say, hey, I'm here to learn. I'm going to try to be attentive, but what do you look for in a student when you think that you want that student to succeed? Like, what does a successful student do? Your physicians will be very willing to tell you. I would say just general guidelines. Don't be distracted while you're seeing patients or while a physician is asking you something. Ask a lot of questions. Be on time. It's very important. Make sure you exchange contact information with the staff and your physician. Don't be excessively late. Don't miss days without telling your physician or the staff that you're not going to be there that day. All these things add up to a level of professionalism, and really your physicians aren't really cared about how much you know already, what your step 1 scores were. What they want to see is somebody who's engaged, somebody who's professional, somebody who's attentive, is on time, and then you'll be able to earn a letter of recommendation. I would say 99.9% of all of the students that go on our rotations get a letter. Some of them, if they're excessively unprofessional or they get in an argument with the physician, they may not get as good of a letter, or if they don't show up, they won't get a letter. But as long as you're attentive, you're there on time, and you're professional, you ask questions, you're nice to the staff, you'll get a letter. If you don't ask right away, or you don't ask in the first week, please make sure to ask for your letter of recommendation at least 1 week before you leave the rotation. This is really important. Yes, physicians are used to getting emails a year later from students saying, hey, I'm ready to upload into ERAS, but it's better to ask now so the physicians know. Then when you come back, you say, hey, I rotated with you last August, I'm going to match this year. Can you upload that letter? It's important that the physician knows that that's what you want to do, and they matched at 1.2, so they're aware of what you need, and they're there to help you. Okay, schedule and reporting time. So if you were fully enrolled, you should have received a schedule. It should be on the program description as well. If not, or if you can't find that schedule, please email Kelly. We'll send you the schedule for that rotation. Relating to this, there were some questions about transportation in different locations in the larger cities, so New York, Chicago, Los Angeles. There should be some public transportation. If you have any questions about public transportation, we'd be happy to help as well. Otherwise, if you're further from your location, there's usually, instead of trains, there's buses or Uber, taxis, anything like that. If you have to travel to a different location, normally the physicians will drive you. Some of you may have cars. I think it's important just on the first day, ask the physician when they're going to be going to each location. Generally, it should match up with the schedule. However, a lot of times it's based on patient loads, so physicians may have less patients at one location, more patients at another. So again, it's just important. First day, you go in, you take the schedule, you use the administrators. The administrators are there to help you. The physician really wants to help you, so communication will help you with that. And then, in general, there were a lot of questions about can I do this on an observership? Can I do this on hands-on? The way I would think about it is this, if you're doing a hands-on rotation, it's a lot like your typical medical school rotation, except for the fact that you can't do any invasive procedures. So those of you who are on a surgical rotation, you're not going to be assisting in surgeries. What you are going to be doing is in the outpatient setting, you're going to be doing the patient interaction, the histories, the vitals, the non-invasive procedures, the outpatient type things, getting a lot of patient interaction there, practicing for your step 2 type skills in the U.S. system. All of that is really important, just getting to figure out how to interact with the patients, see how those surgeries interact with the outpatient system in the United States. The outpatient system is, unlike most other countries, most things in the United States are moving out of the hospital because it's actually more expensive to be in the hospital. So every part of the rotation is great. The hospital exposure is very good as well. It's important to have that, see how a hospital works, but you're going to get the majority of your patient hands-on time in the outpatient setting. Now, for observers, you're still doing the question and answer, you're seeing patients. The thing is, you're living through the nurses and the physicians. So you may get to do some light physical exams, maybe some history taking, but really you're going to be working off of basically your case presentation. So it'll say patient presents with this, that patient's there. You're going to have to do a differential diagnosis, some case presentation. Physician will work with you, say, oh, they think it was this or it was that. So it's still going to be very interactive with the physician. You're going to talk with the patients, that sort of thing. The key is, it's just hands in your pockets. So you still have the ability to demonstrate that you're a talented student, you're professional, you're attentive, you're on time, and you have knowledge and you're learning. And all of those things in the observership can still add up to a great letter of recommendation. So I think that's generally it. If you have any further questions, feel free to email Kelly. Anything specific, we'd be more than happy to help. Other than that, have a great rotation in August. You're going to enjoy it, and take care. Thanks.